Alright, this is medication checkoff video number 2 for the Hill College Johnson County campus. This is your practice video to help you practice. You can practice this at home. If you have not watched the first video that talks about checking your physician orders to your MAR, you need to go back and do that. Don't start this video until you've done that part because it all goes together. Okay, so now that we are at our med cart, we are going to take our MAR and our physician order. I'm going to go ahead and hand my physician orders off to my instructor. That way she can see what I'm doing while I'm at it. And she has taken that from me. I also make sure that I have my vital signs. I have everything here. If you'll look at the cart, you want to make yourself familiar with the cart. You should have patients' names with drawers. We know that we have Dennis Allen from looking at the MAR. I have a drawer for Dennis Allen. Most everything should be in your drawer. If it's not in your drawer, you want to make sure that you're familiar with the rest of your drawers. I have syringes. I note that I have promethazine, a Practi vial of sodium chloride. I'm also noting that I have regular insulin, Nph Insulin, some more promethazine, some Practi TB. Just kind of look it over. Make sure that you know what is in your drawers. Don't spend a lot of time on this, as this is a timed. So once you have everything you want to check, you want to make sure you have a couple trays, you have a med cup, you also have your trash can. You're going to go ahead and start. I'm going to go ahead and gel in. You also want to make sure that you have some type of sharps container nearby in case you need that. So now that I'm ready to go, I have my patient, Dennis Allen. I'm going to go ahead and pour his drawer out so that I can use it. Now that I have his drawer out, I'm going to double check the name. I have Dennis Allen, Dennis Allen. This is where I'm going to start my first check on my meds. I'm going to go ahead and put one of my trays over here. This is where I'm going to put my meds that I have done my first check on. I'm also going to have a second tray that we'll utilize later for our second check. So, looking at my MAR now, I know that I need to get a Practi Mite K 8 milliequivalents POQ day. I noted that earlier that I was going to give this one, so I'm going to look in the drawer for a Practi Mite K. I have Practi Mite K 8 milliequivalents, Practi Mite K 8 milliequivalents. It is by mouth. It is a capsule form. There's no rips, tears, anything in this, and it is given every day. It is 9 a.m., so I know that I'm going to give that one. You also want to make sure that you note the expiration date, which is 11/20. Once I've done that, I've done my first check. I can make my second check mark. Remember, the first one was from you checked your MAR to your orders. The second one now is where I've done my first check on that med. My next med on the MAR is a Practi Lipt, 10 milligrams by mouth QHS. That's a night med. QHS means at night, so I'm not going to give that this morning. My next med is a PPD, 0.1 ml intradermally to be given today. I did note earlier that I want to give that med, so I'm going to look in the drawer for that. I have my Practi PPD. So the first thing I want to do is go ahead and check that medication against my MAR. I have a Practi PPD, a Practi PPD. It is 0.1 ml. It shows that it's 5 tuberculin units per 0.1 ml. And it's given intradermally, which means that I know I will have to have a syringe. And it's given today and to be read in 72 hours. You want to make sure you look at this. It has been opened, so I want to note that there is a date on it and initials. That is current date. These should be discarded within 30 days of use. And so you'll want to get rid of it if it's anything over 30 days. This one expires 20/20. I note that it does not have any particles or anything. It is clear. I also note that it's open, so I'm going to go ahead and have my alcohol. And I'm going to put an alcohol swab on that. I'm going to go ahead and get a tuberculin syringe. It's in my second drawer. You want to look at these. If you're not familiar with them, become familiar with them. This one shows to be a tuberculin syringe. It's for tuberculosis only. So I'm going to pull one of those out. This tuberculin syringe shows for tuberculin single use only. You'll want to make sure you look at the package, make sure it's not ripped or torn, and you'll want to look for any expiration date if there is one. Once I've looked at that, I'm going to go ahead and open it. And I'm going to go ahead and just look at this, make sure there's nothing wrong with that syringe. And I know that I needed 0.1 mLs of the PPD, so I'm going to go ahead and pull this back to 0.1 mLs. 0.1 mLs in there. So I'm going to go ahead and uncap this. Okay, this one came apart and I touched it, so I'm going to discard this one and get another. I have found another tuberculin syringe. I note that this is for tuberculin TB syringe. It's not ripped or torn, and it expires 3/2017. Once I've done that, I'm going to go ahead and discard. I'm going to go ahead and pull the top off of it. I note again that I needed 0.1 mLs. This actually has a part that moves, so you'll want to make sure you move that and move it out of your way. I have 0.1 mLs. I have drawn up air. I'm going to go ahead and remove my alcohol wipe. I'm going to insert that needle, push that air in, and go ahead and grab my syringe and invert it. You want to make sure that you have some type of hold on both of them. I'm going to go ahead and pull back, push that back up to 0.1. Look at it and make sure there's no air bubbles in it. If there is, go ahead and pull it back just a little bit more and push it up. That should get rid of it. Okay, I noted that it's out of there. I'm going to go ahead and show both of these to my instructor. I have 0.1 of Practi PPD. And once I've done that, I'm going to go ahead and set it back down. Don't ever recap your needles by picking up the lid and recapping it. Always take it and put your needle back in. If it's laying down, slide it in and then recap it. I've used this. This is my PPD. I'm going to go ahead and set it over here because I've already done my first check. I now have PPD here. I'm going to make a label. I have a PPD that is 0.5, correction, which is 5 tuberculin units, which is 5 tuberculin units per 0.1 ml. 5 tuberculin units per 0.1 ml. It expires on 20/20. I'm also going to note the date on here, my initials, and I'm going to put my patient's name on it. This will be utilized in the next video to show you. You'll want to make sure that you keep it below the area. Make yourself a little flag. It makes it easier to read. I now have that ready to set over here. I did my first check on my PPD. I'm now ready to move on to my next item. The next thing I have listed is a Practi Lasix 40 milligrams by mouth BID. I know that BID is twice a day, and so he'll get one at 9 o'clock. I'm going to go back to my drawer and look for my Practi Lasix. And I've located a Practi Lasix, so I'm going to go ahead and bring it right down here to look at it. I have a Practi Lasix, 40 milligrams, 40 milligrams. It's by mouth, it is in pill form, there's no rips, tears, or anything wrong with the package, and it is twice a day. I'm also going to note the expiration date, which is 11/20. I have done my check on that. I'm going to put it in my deal. And go ahead and mark that off. I now have 2 checks. Remember, one was for your MAR, the orders, and this one is for the first check of the medication. I now note that my patient did need insulin. His blood sugar was 273. That means that I'm going to be giving him blood sugars between 251 and 300 of 6 units. I'm going to go ahead and get my label over here. I know that I'm going to be giving regular insulin 6 units, and you want to make sure that you write out units. Don't ever use just U. It's not accepted anymore. And I'm also going to be giving, he also has a long-acting insulin, and I'm going to put both of those in the same syringe so that I only have to poke my patient once. I have an Nph Insulin, which is 14 units. And he gets that twice a day, so I know that I'm going to give that. I'm going to go ahead and date this and initial it and put my patient's name on here. When I get my vials, I will note the expiration date. Okay, so I'm going to go back over here. I know that I need regular insulin for a blood sugar of 273. So I'm going to get regular insulin. I have a regular insulin. I'm going to go ahead and bring it down to look at it. Regular insulin. It is regular insulin. It's to be given sub-Q, which means I will have to have a syringe, and it's to be given every AM. I know that I'm giving 6 units because it was a blood sugar of 273, and the blood sugar between 251 and 300 is 6 units. I'm also going to make sure that I note the expiration date on here. Expires 20 of 20. This is an open vial, and I did check for the date and the initials on it. And I also looked to make sure there's nothing floating, broken, or any issues with this vial. I do see that it's open, so I'm going to go ahead and put my alcohol on it. And I'm going to set that aside. I'm going to go ahead and get my NPH and I did my first check on my regular insulin, so you want to make sure that you make your check mark. I'm going to get my NPH insulin. So once you have your NPH insulin, you're going to do the check again. You're going to do NPH insulin, NPH insulin. It's going to be 14 units, and I did note that on my label. It's sub-Q and it's twice a day, so he's going to get that twice a day. This is Practi NPH insulin. NPH. It is open, so I have noted the date, and it expires 20 of 20. I know that I have the correct medication, so I can go ahead and make my second check mark. You want to make sure that you look at this medication. It is a Reconstitution, so you want to either gently shake it, swirl it, or roll it between your hands. Don't ever just take the medication and shake it rapidly. It can damage the medication. And this is an open vial, so I'm going to go ahead and use my alcohol. And have that on top there. Again, you will know that with insulin, you're going to always go from clear to cloudy when you're bringing it up into your syringe. So you may find in your drawer that you have several options. I can see here that this insulin syringe is a 30 ml. This one's also a 30. You might also find a 100 unit, unit, not mLs. You may find a 100 unit. You may find a 50 unit. These are 30 units. I know that I have to give a total of 20, 14, and 6, and so I'm going to use the smaller syringe. Once I pick my syringe, I'm going to again look at the package, make sure that there's no rips or tears. Everything looks intact, and it does expire 9 of 2014. I'm going to go ahead and open that. Now that I have my syringe, I know that I'm going to be giving clear to cloudy, regular to NPH. So at first I need my NPH is cloudy, so that's going to be the first one that I go in. That's going to be the last one that I go into.
But you'll inject your air first.
So I'm going to inject my H first. So I know that I have 14 units. You want to inject your cloudy first, so that's 14 units. So you want to make sure that you pull it back to 14. I don't know if you can see that very well, but I do have 14 units. And you'll show that to your instructor. I'm going to go ahead and inject that 14 units of air into that NPH and pull that back out and recover it. I now know that I have to have 6 units of regular, so I'm going to bring that right back down to the 6 units. So I now have 6 units of air in my syringe. I'm going to show that to my instructor. And I'm going to pull off the regular. And I'm going to insert it. I'm going to put the air in it, and I'm going to lift that right back up. This is the time when you'll pull back 6 units. You want to pull it back fairly fast. Helps get all of those air bubbles out. You want to push it back to 6 units. Once you're satisfied that you don't have any bubbles or anything in there, you're going to want to show your instructor, I have 6 units of regular insulin. From here, you're going to go right into that NPH. And if you'll recall, you're going to need 20 units. You don't want to go past that 20 units. So we're going to go ahead and insert it. Bring it back up. And I'm going to note that I'm going to bring that right back to 20. Looking at it, I'm bringing it to 20. Okay. I now have that on 20 units. I'm going to go ahead and show that to my instructor. If you go past, you want to make sure that you discard that needle and start over. You cannot push back in once you have regular insulin in your syringe. You would have to completely start back over. Now that I've gone here, I have 20. I'm going to go ahead and cover this. And I'm going to go ahead and label it with that label I made. I want to note also my expiration dates. The NPH expires 20 of 20. And my regular expires 20 of 20. You want to make sure that you note them both because they won't always be the same. Being very careful not to push that syringe. You want to bring this down to where you're able to see it. You don't want to cover what you're looking at. Again, make yourself a little flag. And you're going to set that aside. I have done my first check on my insulins. Those are ready to go. Working my way down. I've already done my NPH. I note that I have Toradol. Toradol was 100 milligrams IM, Q3 to 4 hours, PRN for pain. I would ask to make sure that it's okay for my patient to have some. Find out when the last time that my patient had pain medication. When was the last time my patient had pain meds?
Yesterday.
Patient had pain medication yesterday, so he is allowed to have some now. My patient did have pain, so I'm going to go ahead and pull my Toradol. This is a Reconstitution. You'll note that it's a dry powder. Have Toradol, 100 milligrams, IM, Q3 to 4 hours, PRN for pain. I have Toradol. It's going to be 100 milligrams. Right now, I want to get this reconstituted to the correct dose, and then I will do my correct check. So, now that I have practic dosage, you're going to note on here the first one is the strength of the prepared solution. So, the second is the amount of diluent to add. The third is the volume of reconstituted solution. The strength of the prepared solution, I know that my patient needs 100 milligrams. I'm going to go ahead and reconstitute this to the 500 milligrams per ml. For practice purposes, I'm going to go ahead and reconstitute it to 300 milligrams per ml. So that tells me I have to have 5.6 ml of diluent. It will tell you on the bottom of here to be reconstituted, add 0.9% sodium chloride and rotate until diluted. So that tells me I'm going to have a vial of 0.9% sodium chloride. I'm going to go back to my drawer. You want to make sure that you read these vials very closely. This one contains 0.9% sodium chloride. Some of these may say sterile water. Make sure you pay attention to your vials and read them. I know that this is 0.9 milligrams of sodium chloride. To reconstitute this to 300 milligrams per 1 ml, I have to add 9.6 mLs. So I'm going to go ahead and pull a syringe to do that with. When you're in here looking, you want a fairly large needle, so make sure you know your needle gauges. I'm going to go ahead and use a 22 gauge for right now, because this is a fairly large needle. get the diluent out. We will change it again. You're going to look at it, make sure there's no rips, tears. Go ahead and open that up. Set it aside. I'm going to go ahead and open up my syringe. You can pull these like this, or you can just take it and pop it open. Once I have that open, I know I need 9.6 mLs. So I'm going to go ahead and pull that back to 9.2, 4, and 6. I'm going to go ahead and put my needle on. Notice how I kept it inside there to keep it sterile, and then I just pull that off. I now have this ready. I've looked at it. It says 9.6. I'm going to pop the top off of my sterile normal saline. I'm going to insert it in there. I'm going to go ahead and push that in and draw back to 9.6. The main thing you want to make sure is that it will automatically start to pressurize and pull. Notice how it's got a lot of bubbles. I've got air in there. Just push that right back up. Go ahead and just take that and work all those bubbles out. One of the things you can do is just make sure that you've got as many bubbles out as possible. Everything appears to be good. I'm going to look at this and see if I'm at 9.6. I'm not, so I'm going to make sure that I bring that down and get every little bit of water out of there. Okay, I'm sitting at 9.6. I'm going to show that to my instructor. I'm at 9.6. I'm going to go ahead and pull that out. I'm done with this bottle. I'm going to open my Toradol. And I'm going to go ahead and reconstitute this just by pushing it in. One of the things that you can do, it's fairly tight right now. I don't know if you can tell that. But you can pull this needle back up just to where it's in the air. And let that just pull that air out. See how much air came out of there? It'll make it easier when you're reconstituting, and it won't spew when you pull this needle out. I've pulled it out. I'm going to go ahead and discard this. I'm finished with it. I don't need it anymore. Now that I have my vial, it needs to make sure that it's reconstituted well. I'm just going to swish it, roll it in my hands. And I now have a reconstituted Toradol. I know that I reconstituted it to 300 milligrams per ml. So I'm going to go ahead and look at my Toradol. I now have Toradol, 100 milligrams. That means that I'm going to have to do some DA. I know that I have Toradol. I need to get to mLs. I'm going to have 1 ml is equal to 300 milligrams. And my patient needs 100 milligrams. Get rid of my milligrams. That leaves me with the mLs that I want. If you have to, there should be calculators located. I'm going to take 100 and divide it by 300. I note that my patient needs 0.33. Okay, I did my check on this. I have Toradol. Expires 11/20 of 20. I know that my patient's going to require a dose of 0.33 mLs. So now that I'm ready, I've done my check on it. And I checked my expiration on my saline earlier. It was 11 of 2020. Always want to make sure you check everything. If I didn't verbalize it then, I was checking it. You're going to need a small syringe, 0.3 mLs. So you can use a about a 5 ml syringe will work. I need like 1 ml. Let me check that. This is 0.3 tenths. So I'm going to need a 1 ml syringe. Okay, I've located a 1 ml syringe.
We can replace it.
I have a 1 ml syringe because this is 3/10 of an ml. I'm going to go ahead and look at that and pull it back. It's 0.33. So you're going to go 0.3, 1, 2, and 3. I'm going to show that I have 0.33. I have my Toradol. I'm going to go ahead and wipe that off because I have touched that vial. I'm going to uncap it. I contaminated, so I'm going to get rid of this one. Okay, I have a 1 ml syringe again. This goes to show you that anything can happen during your checkoff. Do not freak out. Don't stress. Think about it. What are you going to do if you're going to correct the problem? Okay, I've got another 1 ml syringe. I'm going to bring that back to 0.33. I have a 0.12. 0.33. And I'm going to go ahead and pull that off. Once I have that off, I'm going to go ahead and stick it into my bottle that I had already wet with alcohol. I'm going to go ahead and flip that up, draw it back to that 0.33. I want to make sure you get rid of any bubbles. Okay, all my bubbles are gone. I'm going to check that again and make sure I have 0.33. I have 0.33. I'm going to show that to my instructor. I'm going to go ahead and pull that out. I'm going to recap that needle by laying it down. I note that I've used this needle and I'm going to have to give this is an IM injection. So I'm going to need something longer than this, and this one's already been used. So I know it's a small dose, so I can go in the deltoid. So I'm going to go ahead and use a 25 gauge. Not very long, is it?
5/8.
Yeah, we may not use that one. That's a 5/8. That's a 1/2 inch. We could use it, but my patient's a little bit bigger. So I want to make sure that I have the right size needle.
There you go. That's a 1 inch. That 22 gauge was a 1 inch.
22 gauge. I'm going to...
The ones under the blue ones.
22
Those
gauge?
are 1 inch.
1.5.
Those are ones.
Okay. Alright, so we have found a 22 gauge, 1 inch, which will be perfect for what we need. I'm going to go ahead and open that. I'm going to pull this one off. And I'm going to go ahead and put that one right back on there. Most of these little 1 ml syringes will have a lure lock system to where you can just twist that right back on. You're going to leave it packaged. I'm going to discard that needle. Put my Toradol out of the way here. I'm going to make my label for my Toradol. I have Toradol. It is 100 milligrams. It expires 11 of 2020. I'm going to date it, initial it, and I'm going to put my patient's name on there. I'm going to go ahead and label that syringe. And I'm going to set it aside. I'm going to look at my orders one more time, my MAR. Tylenol for fever, my patient had no fever. Phenegrin for nausea and vomiting, my patient did not have any nausea and vomiting. So I am ready to do my second check on my medications. This is the second check that you will do here at the cart. So I'm going to go ahead and put my drawer away because I'm done with it. Now I'm going to take everything from here and I'm going to bring it right back over here. This will be my second check. I'm going to start with my meds. I need a Practi-K. Practi-K, 8 milliequivalents. It's by mouth. It is by mouth. And it's given every day. And it expires 11 of 20. That's my second check. I'm also going to go ahead and check my Practi-Lasix. Practi-Lasix, 40 milligrams. 40 milligrams. By mouth BID. It expires 11/20. There's no rips or tears and it is in the right form. That's my second check. I'm going to go ahead and check my PPD. I'm going to bring both of those over. I have Practi PPD, 0.1 ml. I now note that I have it in the correct route. Practi PPD, 0.1 ml looking at it. I have it labeled correctly. And it expires on 2020. That is my second check. So I can go ahead and set that over. You won't need to take the vials to the room now that you have your syringes labeled. So now I'm going to check my insulins. I checked my insulins. I have regular insulin. Regular insulin. My patient was at 273, so I have 6 units. I know that I have 6 units because I drew it up in here and I labeled it. I have regular insulin. Regular insulin. And it expires 20 of 20. My second check. I also have Nph insulin. I have Nph insulin, 14 units. Nph insulin. Expires 20 of 20. And I have it. I labeled it regular and Nph. I have a total of 20. So that's my second check. I'm now going to check my Toradol. I remember that I reconstituted it to 300 milligrams per ml. I did my math. I have Toradol. Toradol, 100 milligrams. 100 milligrams is 0.33. And it is IM. I do have the correct syringe length for that. Q4 hours for pain, Q3 to 4 hours for pain. And it expires 11 of 2020. That's my third check. Now that I have everything on my table, I've done my checks. I should have 3 checks. 3 checks next to each one of my meds. That means that I'm ready to go to the bedside.